Bismillahirrahmanirrahim. Alright, guys, welcome to my YouTube channel. My name is Dr. Haroon, and today we are gonna learn about bacterial vaginosis. Okay, so we're going to discuss it under definition, clinical features, diagnosis, differential diagnosis, oh my god, and management. Okay, looks scary. I'm going to keep it short so that your ADHD brains can focus and it won't wander. So without further ado, let's get started. Okay, so what's the definition of bacterial vaginosis? It basically means there is an overgrowth of anaerobic organisms in the vagina, like Gardnerella vaginalis. So if anaerobic organisms they continue to grow, aerobic organisms they will decrease, inversely proportional. Okay, remember that. So basically what it does is it causes an increase in the vaginal pH, so it makes the acidic vagina a more basic environment. Okay, that's it. Now we're going to go to the clinical features. There is not much clinical features in bacterial vaginosis, except there's a vaginal discharge which is fishy and it's offensive. So I have given a picture of a fish here so you can remember. Okay, and in more than 50% of the women it's asymptomatic. Ooh, fine, there's it. Now we come to diagnosis part. So for diagnosis of bacterial vaginosis, we have got the AMSELS criteria. So what's the AMSELS criteria? It's basically, it has got 4 points. And in that 4 points, at least 3, minimum 3, see, I have drawn a big 3 here, minimum 3 should be positive to classify it as bacterial vaginosis. Just remember fish, clue cell, and a pH of more than 4.5. If you remember this, you'll pass the exam. Okay. And this one also a white drop. Okay, so basically what it means is that thin white homogeneous discharge, which you can already see here. This is it. And the next we have got the clue cells on microscopy, which you can see here. So yeah, these are the clue cells. Yeah, and the vaginal pH of more than 4.5. Okay, at least 3 of this should be positive. Or if your attention span is a bit better, you can also remember the positive whiffs test. So basically what it does is that when you add the substance potassium chloride to the sample, it gives out a bad smell, a fishy odor like smell. So that is called as the positive whiff test. Okay, now we come to the last part of this, the management. So we're going to discuss it for 3 case scenarios. One is an asymptomatic patient, one is a symptomatic patient, and the last is a pregnant woman. Okay, so for an asymptomatic woman with bacterial vaginosis, we give no treatment. The disease it resolves on its own. Okay, so we don't need to give any treatment. For a symptomatic women, we go with an oral metronidazole for 5 to 7 days. Okay, and even after giving that, more than 50% of the women they relapse within 3 months. Yeah, sometimes it works, sometimes it doesn't. That's life. Okay, and then sometimes even after giving metronidazole it might not be effective. So in such cases what we do is we give a single 2-gram dose of metronidazole, okay, which can be used if adherence is an issue. Okay, and the last case which we are going to discuss is bacterial vaginosis in a pregnant women. So, I mean, if a pregnant woman she has bacterial vaginosis, then there is an increased risk for preterm labor, chorioamnionitis, and miscarriage. Remember it as PCM, okay? Physics, chemistry, and maths. I just gave you a mnemonic. Physics, chemistry, and maths. Preterm labor, chorioamnionitis, and miscarriage. So, what do you give for treatment of bacterial vaginosis in a pregnant woman? Nothing, just the same oral metronidazole. Okay, That's pretty much it. There's nothing, no rocket science here involved. So we discuss about bacterial vaginosis. We discuss about the definition, clinical features, diagnosis, management. Okay, differential diagnosis. Just remember it as there is only one, as far as I know. I just forgot to write it. Let me just write it down here. Mm, Trichomonas vaginalis. Trichomonas vaginalis. This is on differential diagnosis, and we discuss about the management. Okay, so again, let's just recap. Definition: it's basically like growth of anaerobic organism. If anaerobic organisms grow, then aerobic organisms they decrease. So if an aerobic organisms decrease, aerobic organisms they produce acid, and anaerobic organisms they produce base, so it results in increased vaginal pH. And then next we discuss about the clinical features. There's nothing, just vaginal discharge, which is fishy and offensive. You got a fish right there. And then it's asymptomatic in more than 50% of the women. How do you diagnose bacterial vaginosis? There are 4 points. We use AMS's criteria, and there are 4 points. Out of those 4 points, only 3 must be positive. One is a dead fish, fishy and offensive odor. That's the clucel, and another is pH of more than 4.5. Okay, that's it. Management: asymptomatic, symptomatic, pregnant women. Asymptomatic, give nothing. Symptomatic or metronidazole 5 to 7 days, and even after giving that, there is a relapse in more than 50% of the women. Okay, next we have whether in pregnant women bacterial vaginosis may cause PCM. What is PCM? Physics, chemistry, maths. Nah, I'm just kidding. I'm just being stupid here. It's a preterm labor and chorioamnionitis and miscarriage. Okay, and it's the same for symptomatic treatment, and for asymptomatic treatment it's the same. We give oral metronidazole. Ooh, thank you, and do please subscribe. I'm a new YouTuber. I'm a wannabe YouTuber. So just subscribe to my channel, and I'll try to make more content related to medicine. Thank you. Have a good day.